Okay, let's jump to page 252. On page 252, so now, as we get closer to the end of our presentation on cardiovascular physiology, and then before we move to the next thing, there's always another thing. Let's talk about the regulation of blood flow and blood pressure. Our blood pressure doesn't happen to stay, 120/75 because we're lucky. There's homeostatic reflexes. Just like our body temperature doesn't stay at 37 degrees centigrade because we're lucky. There is thermoregulatory homeostatic reflexes. Everything in our body is being regulated. This is called homeostasis. That is the theme of this course, of how our body controls and regulates everything. Our thyroxine levels are regulated through a negative feedback loop. Everything is, this regulation and control. So, just as we've talked about other control centers in the past, there is a cardiovascular reflex center in the medulla oblongata of your brain. Again, I'm trying to keep this simple, because actually if you read the book on the cardiovascular system, you will learn that in the medulla oblongata there's a cardioacceleratory center, a cardioinhibitory center, and a vasomotor center. I'm going to collectively refer to them just by one name, cardiovascular reflex center. Its primary function is to maintain the average blood pressure in the systemic arteries at an average of 90. Its job is to maintain the average arterial blood pressure in your systemic arteries at 90. Now, in order for it to maintain our blood pressure at 90, it needs to know in real time what is our blood pressure. And it gets that information from sensory neurons called baroreceptors, which we've mentioned before. They are monitoring our blood pressure. Now, as we've learned with all these other control centers, if this provides information as to what our blood pressure is, if the average is 90, and this desired set point is 90, all the center does is compare our actual average blood pressure in our arteries with the desired. If they match, it doesn't have to do anything. But if our actual blood pressure starts to go down, lower than 90, or higher than 90, it's got to compensate. And it's going to do that by activating parasympathetic or sympathetic autonomic motor neurons to our heart, our veins, and arterioles. By affecting, for example, sympathetics to our heart, that affects cardiac output. By affecting sympathetics to the veins, that affects venous return. By affecting the arterioles, that affects total peripheral resistance. And by changing these things, you can get that blood pressure back up. Now, where are these baroreceptors located? Look on the next page, 253. On 253, at the top, picture on the top right. So where are these sensors, these sensory neurons? There's two major ones. There's a group of sensory neurons, baroreceptors, right here in the aortic arch. They're called the aortic baroreceptors. And there's other baroreceptors right here in the carotid artery, right where the carotid artery bifurcates into, goes from a common carotid to an internal and an external carotid. So there's a little bulge right there. Those are called the carotid baroreceptors. Now, where these baroreceptors are monitoring your blood pressure is exactly, I think, where you would place them if you were going to design the human body. The blood pressures that we are most worried about, if they become too low or too high, is first of all in the biggest blood vessel in the entire body, the aorta. So that would be really good to monitor what the blood pressure is in your aorta, the biggest artery in the whole body, where all the other arteries branch off it, carrying oxygenated blood to the body. And then, what's the most important organ in the body? The brain. That's where the sensors are also located, in the carotid artery carrying oxygenated blood to the brain. So if you don't want to put sensors in every single vessel, Doesn't it make sense to put them in those two? And that's where they are. So we have the aortic and carotid baroreceptors. You can see in this picture right down here, it just tries to show, here it shows an axon from this sensory neuron coming off, monitoring this blood pressure. And these baroreceptors are actually located in the glossopharyngeal nerve, cranial nerve number 9, that sends the signals to your brain. Now, that takes us to page 254, and we're going to look at the bottom of 254 and understand this reflex. The name of the reflex is the baroreceptor reflex. It is activated whenever our blood pressure either becomes lower or higher than what is desired, the set point. Let's assume, for sake of discussion, that for whatever reason you had a drop in your systemic arterial blood pressure. For some reason it's dropping. And we're going to give you examples of what could cause it to drop in a little bit, but it's dropping. So, the baroreceptors in the aorta and carotid artery inform the cardiovascular reflex center of this. Oh my gosh, the blood pressure's dropping! Right? Now, you'd say, well, why do we care? Well, you know, who cares if the blood pressure drops? If the blood pressure drops, that means the pressure pushing blood, oxygenated blood through your vessels is dropping. You're going to start to get reduced oxygenated blood everywhere in your body, including up to your brain. When you get less oxygenated blood to your brain starts dying. So this, you know, better maintain this blood pressure. So, what does the cardiovascular reflex center always do when the blood pressure drops? It activates the sympathetic motor neurons, which are always activated during stress, crisis, emergency, life or death situations. It activates the sympathetics to the heart, the veins, and the arteries. Now, what is the sympathetic action on the heart? Didn't we learn back on our chart on 105 that sympathetics increase heart rate, which is also called tachycardia? All right? Now, is an increased heart rate going to tend to increase cardiac output? Yes. What effect do the sympathetics have on myocardial contractility? Increase. So your heart is not only beating faster, but more forcefully. That increases stroke volume, that increases cardiac output. What else? The sympathetics cause the veins in our body to constrict. We have explained when the veins throughout your body constrict, that squeezes more blood to your heart. You'd say, well, won't it go backwards? Remember, there are valves that prevent it from going backwards. So that squeezes more blood towards your heart. That's called venous return. And if more blood goes to your heart, that increases the filling of the ventricle with blood and diastolic volume. And according to Starling's law of the heart, if the ventricle fills with more blood, it'll eject more blood. So that also helps increase cardiac output. Now the sympathetics also, and we learned this on page 105 in our autonomic chart, sympathetics cause generalized arteriolar vasoconstriction. They cause the majority of blood vessels in our body to constrict. We have learned today that that increases total peripheral resistance. Now if you want to, just as a visual aid on this, here's a visual. Imagine on our water faucet, here's what's happening. We've turned on the faucet more, so more water is coming out the faucet, and we've squeezed these arterioles so that the blood, the resistance is increased. Can everybody see that's going to raise the pressure in this segment? Does that make sense? Now, if you don't believe me, all you have to do is take a garden hose, turn on the water a little bit, right, and squeeze the hose, and then turn the water on even more. So now you've increased the flow of water out, and you're squeezing the hose. The pressure here in this part of the hose has to increase. Now, I should mention, you might say, well, how's that going to help anything by raising the pressure just in this segment? most vessels in the body are going to constrict. We know that the vessels to the heart, they'll actually dilate. To the skeletal muscle, they'll tend to dilate. There's one set of vessels that neither constrict or dilate, the vessels to your brain. So notice what we're really doing. We're decreasing the flow to almost everywhere in your body. We're constricting and reducing blood flow to your GI tract, to your kidneys, to all of the non-essential organs. We're dilating vessels to your heart's working harder, and the vessels to your brain stay the same width. We are basically directing and diverting that blood pressure and blood flow to your brain. That's really what's going on. We've constricted the majority of vessels in the body. So there's less blood flowing everywhere in your body. Some places it's increased to your heart and skeletal muscle, and to the brain, we just want it constant. We simply wanted to make sure your brain stays alive. That's this baroreceptor reflex. Why does the brain want to stay alive? Where is this reflex center located? In your brain. Its job is to make sure the brain gets it first. We're most important, because frankly, if the brain goes, nothing else is going to matter. You could be what do they call it? A living vegetable, right? But this is what the body is designed to basically maintain the brain alive. That's what it's doing. So, all of this, we remind you at the bottom of this page, 254, that there were two major factors that determined your blood pressure in your arteries: cardiac output and total peripheral resistance. What is the baroreceptor reflex doing to cardiac output? Increasing it. What is it doing to total peripheral resistance? Increasing it. Obviously, if you increase both, the blood pressure goes up. So whether we look at this analytically with a formula or intuitively with this picture, we're raising the pressure here in the artery. All right? Now, this is what happens when your blood pressure drops for any reason. I didn't write it down, but obviously, if your blood pressure went higher than normal, it's got to be just the reverse to lower it back down. So if the blood pressure goes too high, the Cardiovascular Reflex Center activates parasympathetics to slow down the heart rate and lower the blood pressure, right? We've got to lower it. Just the reverse. But usually the bigger problem is the blood pressure is dropping. Now, on page, let's look on 255. Oh boy, this is good. Now, I want to remind you of something that we said earlier today. I know our first thought is, oh my gosh. Well, so I just want to remind you of what the books show, and my favorite one is this one. Okay, this is, incidentally, what this is showing here, just to zero in on this, is the baroreceptor reflex. So that's what all this junk is, and there's just, oh, here's another one. This is, all right, so this is my attempt to keep it simplified. So let's look at this. At the bottom of page 255, this is page 255. So it says arterial blood pressure. Our blood pressure is constantly being monitored by baroreceptors. They are monitoring the blood pressure in our aorta and carotid arteries. Let's see where that information goes. Let's follow it up, 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 up. And it's going to the Cardiovascular Reflex Center at the top of this picture. And the job of the Cardiovascular Reflex Center and the Medulla Oblongata is to try to maintain the mean arterial, systemic arterial blood pressure at about 90. Now, this diagram shows you a summary of the major factors that affect your blood pressure. Not all of them, but the major ones. So what does it show? We know the average blood pressure in your arteries is determined by two major factors: cardiac output and total peripheral resistance. Here they're shown right here. And then it shows what factors affect cardiac output and what factors affect total peripheral resistance. This part of the chart right here is the same identical chart that was on 214 that you need to know for the third exam. This is what I reviewed with you at the beginning of class today. Didn't we learn cardiac output is determined by heart rate and stroke volume? Didn't we learn that stroke volume is affected by myocardial contractility? And then we learned that their venous return can affect it. It's exactly the same part of that chart at 214. What we've done is we've expanded and added to it. Now, what did we add? We added on this chart what affects total peripheral resistance. Now, there are three things shown, and I only asked you to know two. What were the two? The most important factor that normally affects our total peripheral resistance is the overall degree of arteriolar vasoconstriction. Overall, how constricted or dilated are most of the arterioles in our body? And the second factor was the degree of stenosis. You'd say, what's that? I'm really tired. It's the end of the semester. Give me a break. And stenosis is the degree of atherosclerotic plaque. We won't worry about viscosity of the blood. It's rarely a problem. Won't worry about that. Now, these are the two factors that determine total peripheral resistance. These are the factors that affect cardiac output. Now, here's what's really neat. So, the Cardiovascular Reflex Center, we said that whenever your blood pressure becomes lower or higher than normal, it's got to bring that blood pressure back to normal. Can you see 4 arrows? 1, 2, 3, and 4. Those are the 4 things that your Cardiovascular Reflex Center tries to adjust. What is it showing? It tries to adjust the heart rate. It tries to adjust myocardial contractility. It adjusts venoconstriction and arteriolar vasoconstriction. Those are the 4 arrows. And if you're thinking, I'm tired, okay, I can't help you with that, but if you're thinking I'm confused, look on the previous page 254. On page 254, what are the 4 things that we wrote on page 254 that are changed? Heart rate, myocardial contractility, venoconstriction, and arteriolar vasoconstriction. The same 4 factors. So we're simply showing it in the form of a flow chart. So when the blood pressure drops, the Cardiovascular Reflex Center activates sympathetic autonomic motor neurons to speed up the heart rate, to increase myocardial contractility, which will increase stroke volume, to constrict veins, increasing venous return, increasing filling of the ventricle with blood, increasing myocardial contractility, and increasing stroke volume. Those 3 things all increase cardiac output. And the Cardiovascular Reflex Center will activate sympathetics, causing generalized arteriolar vasoconstriction, and generalized arteriolar vasoconstriction raises peripheral resistance. Obviously, if the Cardiovascular Reflex Center can increase cardiac output, more water comes out the faucet, the arterioles constrict, the pressure in this segment of the hose rises. And analytically, we're raising cardiac output, raising peripheral resistance, which has got to raise blood pressure. This is called the baroreceptor reflex. Now, on page 258, I've circled this on page 258. And this is kind of really amazing. Blood flow to the brain, 258. Since the metabolic rate of our brain always remains constant, blood flow to the brain normally remains constant. Our body does not want to increase the flow of blood to the brain, nor does it want to decrease the flow of blood to the brain. It wants to keep it constant. Here's what's really amazing. The metabolic rate, the need for energy by your brain cells, stays constant, the same whether you're asleep or awake, whether you're thinking or not thinking, whether you're sitting or whether you're exercising. We might have thought that when we sleep, so like our brain doesn't need as much oxygen. We can have decreased blood flow. Not true. And in fact, if you've read the stuff on the EEG and REM sleep and non-REM sleep, so when you're asleep, did your brain stop working? No. In fact, you're dreaming. Your brain's still functioning, and the EEG, electrical encephalogram recording, when you're dreaming, the electrical activity of your brain looks absolutely identical to when you're awake, when your eyes open. That's called REM sleep, rapid eye movement sleep. The EEG electrical pattern looks absolutely the same. You cannot tell whether the person is awake or dreaming. That changes during non-REM, deep sleep. But the brain is always working. So it's not like when you go to sleep, and you might have said, well, look, I'm really trying to concentrate on physiology. I must be burning up more calories in my brain cells. No. You use the same amount of energy in your brain cells whether you're thinking or not thinking. So since you're using the same amount of energy, I guess you may as well be thinking, because you use up the same energy if you don't think. But anyhow, it's kind of amazing. So therefore, the body just wants to maintain constant blood flow. So it may be increasing or decreasing blood flow to other parts of the body, but it just wants to maintain constant blood flow to the brain. It doesn't want to see it drop, but it also doesn't want to see it increase higher than normal either. On the bottom of this page, it informs us that there are many things that can cause blood vessels to constrict or dilate. So here it just shows that there are autonomic neurons that can cause vessels to constrict or dilate. It also reminds us that we know that histamine, we had said histamine, can you see this is on the dilation side? Histamine dilates vessels. Didn't we say that during an allergic reaction you release all this histamine and it dilates all the vessels in your body? Alcohol dilates vessels. The classic caricature of a drunk is somebody with a red face. It dilates the vessels. The reason why drinking alcohol makes you feel warm is it's dilating all the vessels in your skin. So it dilates vessels. Nicotine constricts vessels. One of the dangers of nicotine when people inhale cigarettes, smoke with nicotine in it, is it causes vessels throughout the body to constrict, including the coronary vessels. So the point is, to use the term we've used before, everything is multifactorial. It's just multiple factors as to whether a vessel is constricting or dilating. You've got your own nervous system trying to do stuff, but then when you drink alcohol or you smoke a cigarette, you're affecting, no matter what your own nervous system wants to have happen, you are modifying it. And then there's all these medications people take that may affect whether vessels are constricting or dilating. Let's look on page 259. And on 259, the topic at the top is cardiovascular homeostasis. And it says physiological stress always produces responses mediated by the sympathetics. Okay, we know that. And the stress that I'm going to give you as an example of a stress is gravity. Gravity is a huge stress to our body. That's why we've learned it's so stressful to get up in the morning. Didn't we say cortisol was released because of stress? And you release most of your glucocorticosteroids in the morning because it's so stressful just to get up? And right now all of us are thinking, I wish I would have just stayed in bed. You might remember me mentioning that when you take somebody's blood pressure with a cuff, their arm should be at the same vertical height as their heart, because if their arm is lower than their heart, the pressure you record will be artificially higher than it should be. If it's higher than your heart, it will be artificially lower than it should be because of gravity. So we've written here that gravity will make the blood pressure, it actually causes your blood pressures below the level of your heart to be higher and causes the blood pressure above the level of your heart to be lower. This creates a couple of big problems. When you stand up, right, you go from lying or sitting to standing up, Gravity is pulling the blood towards your feet, raising the blood pressure in your feet. Because when you're standing, the blood pressure in your feet increases, that's why we know that anything that makes your blood pressure in your capillaries increases the filtration of water out of the capillaries, leading to swelling. When you stand all day, your feet swell. That's gravity, because it raises the pressure in the vessels of your feet. Not just the arteries, but the capillaries, all of them. And it causes increased filtration of fluid out of the capillaries, causing swelling or edema. On the other hand, when you stand up, what's happening to the blood pressure and blood flow to your brain? It's going down. We all know this to be the case because all of us at one time or another, we have either gotten up from lying down or sitting too quickly, and we started to feel like we were blacking out, like we were going to faint. Sure, it's happened to all of us. That was the effect of gravity, pulling the blood down towards our feet and reducing blood pressure and blood flow to our brain. This is the challenge of gravity in terms of our cardiovascular system. So one of the other things it does is it pulls the blood down towards our feet, reducing venous return back to the heart. So let's just look at this. When you stand up, and just write the word, stand up. Stand up and feel proud. Okay, so stand up. When you stand up, the gravity pulls your blood down towards your feet. It lowers or reduces venous return. Now, we know valves prevent it from going backwards, but nevertheless, that just prevents it from going backwards. Gravity still prevents it from going forward, back to your heart, because of gravitational pull. So there's a drop in venous return to your heart. That causes a drop in end diastolic volume. What is that? That's the filling of the ventricle with blood. Starling's law says if the ventricle fills with less blood, it ejects less. Stroke volume drops. If stroke volume drops, cardiac output drops. Now our heart's ejecting less blood. If cardiac output drops, our blood pressure drops. Because cardiac output is one of the two factors that determine arterial blood pressure. Now, at the moment your blood pressure drops, the baroreceptors send the signal to your brain. Hey, you got to do something. Hey, the big trouble. You're standing up. The blood pressure's dropping in your aorta and your carotid arteries, and it activates the baroreceptor reflex. What's that? Back on page 254. What is the baroreceptor reflex? Whenever your blood pressure drops, like when you're standing, it activates the sympathetics. Increasing heart rate, increased myocardial contractility, venoconstriction, arteriolar vasoconstriction, raising cardiac output, raising peripheral resistance, your blood pressure rises. Here's how you can relate to this. Just try this at home. You can do it here as soon as we're done. Just stay crouched like this for about 5 or 7 minutes, 5 minutes, and stand up real quickly. And as you start to feel like you're swirling and blacking out, you're going to feel your heart start to pound. That's the baroreceptor reflex. And not only is your heart going to speed up, that's the to try to raise your blood pressure so you don't faint. Because you're fainting because your brain's not getting enough oxygenated blood. That's why you're feeling faint. All right? You're also going to look, especially if you are fairer skinned. It occurs in everybody, but it's more noticeable. It looks like you'll turn white like a ghost. The vessels in your body are all constricting. It looks like all the blood went out of your face. The vessels are all constricting because we've got generalized vaso and venoconstriction. So between the two effects, you should be able to raise that blood pressure up and improve blood flow to your brain and not faint. But what if you did faint? If the baroreceptor reflex cannot sufficiently increase the blood pressure and blood flow to your brain, that drop in blood flow to the brain causes syncope. Syncope is the clinical word for fainting. And here's really what's neat about physiology. Syncope or fainting is considered a homeostasis.